Kansas is fortunate. We've gotten all of our Department of Health and Environment people on board. We're working across systems. So it is, I think, the workforce of the future. When we think about rural and frontier communities, there just aren't enough full-time providers. So that community health worker who's embedded in Extension is that liaison, that link.
K-State Research and Extension is involved in a K-State 105 project to improve rural and agriculture-connected health across the state. Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health and a state specialist with Extension, says the Rural Ag Health Community Health Worker Project focuses on sustaining the health and safety of rural Kansans and the agricultural workforce by establishing resource and service hubs staffed by community workers who are co-supervised by local Extension units and healthcare partners. On today's Sound Living, improving healthcare access for all. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. The partners in the project are recruiting and hiring 5 community health workers who will be based in several Extension districts, including Wildcat, Southwind, Meadowlark, and River Valley, as well as the Marshall County Extension Office in Marysville, which has already hired Arlene Wessel to serve as a community health worker. Johannes joins Marshall County Family and Consumer Sciences agent Susie Latta to discuss the program and what they're discovering as important health needs for the community. Elaine, first off, before we kind of get into our conversation with Susie, maybe some background on the Community Health Worker Program and what it's all about.
Yeah. The needs of rural residents related to health, health care, health access, health literacy are great. And over the years, the United States government and also care providers have figured out how community health workers can fill the gap. Community health workers are those frontline public health care provider liaisons who can weave together the needs of the people, the resident, the producer, the farmer, rancher, with the provider system. And I think most of us are aware the providers of health care are plentiful sometimes, but then in rural frontier areas, there's a shortage of providers. And so how do we help, through Extension, weave together systems and supports? And I'm so appreciative of Marshall County Extension because they've jumped in with showing that a community health worker can help weave and be the liaison between the person's needs and all of these provider systems.
Susie, let's go a little bit more in depth with that. What are you doing in Marshall County that seems to be working well?
Well, I think the community health worker is a great fit for Marshall County. I'm super involved with financial education, so I need a passionate individual that's going to extend the work that I'm already doing, especially related to health and wellness. So I feel like we can really reach more people as look for other opportunities to educate in areas such as prenatal care, blood pressure, diabetes, foot care, balanced mobility, positive thinking. The list is endless of all the things that we could do if we have the right people on board to get the job done.
Well, and a lot of this really fits in with what Extension does to begin with, right?
You bet. It's education with a purpose. You know, it's the importance of building trust and relationships with the citizens of Marshall County to help them be the best they can be.
What have you been working on particularly? Have there been some areas where you started your concentration, I guess, from the get-go?
I think health insurance has been my major focus. I see that there's a great need to do health insurance education, and people need help with that. And so by bringing Arlene on, she has just helped me extend what I'm already doing in finding, health insurance, helping people figure out how to use their health insurance, and then identifying resources that can help them, like the LEAP program, food assistance programs, finding doctors, finding home health care, finding tax preparation services. The list is just endless of all the different resources that people just need the connection to find what they need to make their lives better.
Well, I assume that you are extremely busy right now answering a lot of those health insurance questions.
Yes, Medicare open enrollment, and just about everybody's open enrollment is this fall. So lots of questions, lots of confusion, and hopefully we can provide some education and answers so they can make informed decisions about their healthcare choices.
Maybe a little bit more along those lines. What are a lot of the questions that they have? I know price and coverage are probably the two main factors.
Yeah, and, convenience, what works for them. It's not as easy to go to Kansas City when you're 80 years old, so not everybody has a support system. So what specialists are coming to Marysville. Do they have transportation from the local agency on aging to go to Lincoln or Manhattan or wherever else the bus will take them to? So those are some of the things. But people just want confidence in their decision-making process, and they just want to know what the pros and cons are of each one of their different decisions as they think through their options. I know people that are turning 65 and new to Medicare, they don't know who to trust or where to go to for, non-biased information. And so Extension has been providing them the answers and education in a simple format that they can understand to make good decisions about their health care for the remaining part of their lives.
Susie, I might jump in here since you and I have worked together for many years. You have clientele that trust you, trust your work, your advice. How do you know when you are meeting with people that they need your extender, they need the Marshall County CHW, and they could benefit from having that more longer-term connection? How do you know that?
Just by simply talking to them and having a relationship with them and the things that they bring up or the questions that they ask me, or just by things they're saying, I can say, hey, I know of this program, or I know of this resource, or I know of somebody that might be able to assist you with this, or here, let me assist you with this. They just need the confidence. They just need to find the information. They need to know, and I'm the connector to a lot of different resources and other people that I can refer them to. And so it's just really all about relationship building, and that they'll trust you to ask them questions that maybe they're otherwise embarrassed to just ask. Or, in small rural communities, nobody wants people to know maybe that they're struggling or, that they need some kind of financial help or whatever. But I'm a trusted person. I get to know them pretty well, talking about all their health needs and their prescription drugs that they take. And so just become a resource and a confidant that they can know that they can trust to help them get what they need.
Is this one of the reasons why we think that this might work in other areas across the state as well, as because of that extension community relationship?
Yeah, I think, this can work in a lot of different areas. We just need to find the right people for the job. And we just need to make sure that we utilize our connections that we have within the community. And every extension professional has different resources or different people connections that they have. Like we are connected to a person that's in the HR department at a local medium-sized employer for Marshall County. And so she's bringing us in to help her employees make good and informed decisions about their health insurance options this fall. And then we hope that leads to discussion about what other things that they're struggling with related to health and wellness and problems about getting to work so they can be better employees for their employers. There's great opportunities to be educated to become a community health worker. And so if you're looking for a new profession and you like to help people, maybe this is a great opportunity for you to take the training and become a community health worker.
And in Kansas, we're very fortunate. We're among 12 states now that certify community health workers to be out in the community practicing, such as what Susie's describing and Arlene is doing. And so in this state, the person takes a 160-hour course. 60 hours of that is being in the field, shadowing an agent, helping with health fairs, or like Susie has just described, working with maybe an employer and being out there helping people understand hypertension, diabetes, those kinds of things, plus insurance. So 100 hours of that 160-hour course is actually in content, meaning there's teachers. We're working with Wichita State University now. I do teach a couple of the core curriculum in the course, and it's an online course that people take from all over the state. Usually the course is like filled, 28 people, 34 people who take the course. They meet every week. They go through the content, which is nationally known, and it's nationally confirmed through the APHA, American Public Health Association. And at the end of the 100 hours, then they will continue getting their 60 hours of being in the field, working alongside. After they complete, then they become eligible to be a certified CHW, which Arlene is. And with that certification comes that ability to work with clinics, hospitals, health departments, mental health centers to be reimbursed for their time and their care. And so Kansas is fortunate. We've gotten all of our Department of Health and Environment people on board. We're working across systems. So it is, I think, the workforce of the future. When we think about rural and frontier communities, there just aren't enough full-time providers. So that community health worker who's embedded in Extension is that liaison, that link that Susie's described.
How would you say it's going so far then? Arlene is getting up to speed and on board. So what are you hearing from her, I guess?
I think she's really enjoying it. It's just amazing to see all the different needs of the different citizens. I mean, she was working in a nursing home before, so it's just been interesting for her to see what are some of the needs of the general population, and there's a lot higher need for different kinds of education and services than maybe she really realized, and that how there are a lot of families in our small rural community really struggling and how we can make an impact with them. You really need to know your county, what the needs are, and then find the right people and have the right connections to get the job done of what you want to accomplish with the Community Health Worker Project.
And Susie, I want to compliment you for jumping in. You're really among the leading 5 extension units that are testing this role, and you knew the kind of individual, the kind of skills that would fit with what the county residents need. And that's due to your fact you understand your community and you've worked with residents and you've worked with your citizens a long time. I will compliment our other districts that are doing this work. There are CHWs down in Southeast Kansas, multi-county down in the Wildcat District, another multi-county which is called Southwind. Those CHWs did not come on at the same time that Arlene did. She's ahead of the pack for time and experience, but they're following her to see how she and Susie are doing the work. Then near to Susie, up in Marshall County, adjacent to it, is called the Meadowlark District, and they've just, again, recruited and hired and got their CHW going. That is a different group of counties. Then right over across the way from Marshall County, then that's called the River Valley District. It's also multi-county, and they're in the process right now of recruiting the CHW that's going to be a good fit. So, Jeff, over time, we're thinking that this could be a model that could be shared across the state and across the United States. I'm one of a 3 leadership team that's really looking at how CHWs function within Extension, and we have the opportunity to inform our other states that have similar rural and frontier health challenges and how Extension can actually be a collaborator in supporting the health and the well-being of their residents.
This really, in a sense, boils down to community vitality as well.
Oh, yes. If a community is concerned about recruiting young families for the workforce or retaining them, I was on a Zoom today with the University of Kansas Health Systems. We were talking about trauma and EMS. If the communities are worried about how are we retaining our workforce, how are we keeping our schools going, how do we guarantee that there's access to food, it's all hands on deck. And Extension that has, that good rapport that Susie's talked about is a real strong collaborator in looking at, okay, what are the ways we can weave together not only health care, but health understanding. That's what Susie's doing with her health insurance work. She's informing people so they're empowered to make good decisions and maintain their health. But when they aren't able to do that, when they're having some chronic conditions or aging in place or maybe injury or substance abuse, then we need to weave together support so people can live out in rural and frontier areas with the quality of life they want.
Susie, give you a chance to get the last word in. Any final thoughts?
I think Elaine just said it all. I think, it's just a wonderful opportunity to extend the work that Extension is already doing, and I'm thankful for K-State 105 for giving us the opportunity to experience this model and to see what it can do here in Marshall County as well as across the state of Kansas.
That's Marshall County Family and Consumer Sciences Agent Susie Latta and Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, with information on the Rural Ag Health Community Health Worker Project. On next week's Sound Living, Arlene Wessel discusses her role as a community health worker for Marshall County. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.